First aid. Accidents happen all of a sudden. They happen when we are careless or in a hurry. We can avoid accidents if we are careful and follow safety rules. However, sometimes when an accident happens, we need to give first aid to the victim. First aid is the immediate treatment given to the victim of an accident or sudden illness before proper medical treatment can be given. It is important to have a first aid kit available. Keep one at home and one in your father's vehicle. First aid in an emergency. There are some ways to provide immediate care in the case of certain accidents or emergencies happen. You should keep them in mind when a person is injured. We should not let a crowd gather around a sick or injured person. Make the injured person sit or lie down comfortably. Call an adult for help or call a doctor immediately. Fractures and inflammation. A broken, fractured bone requires emergency care. When the bone is broken, you should never try to move the patient itself in the unlikely event of an open fracture. Apply pressure to the wound with a clean cloth to stop the bleeding until help is available. A sprain occurs when the ligaments, which hold the bones and muscles together, are overstretched and partially torn. Simply overstraining of any part of the musculature is called a strain. Sprains and strains generally cause swelling and pain. It may be visible as bruises around the injured area. If the injury involves the patient's neck or back, do not move him/her carelessly. Movement can cause serious nerve damage. Call for emergency medical help if the patient is unconscious, bleeding uncontrollably, or cannot walk. Get an X-ray examination done to determine whether a bone is broken or it is just a sprain. First aid for sprains and strains includes rest, ice, compression and elevation, known as RICE. Apply ice packs or cold compression for up to 10 minutes at a time, every few hours for the first 2 days to prevent swelling. Wearing an elastic compression bandage for at least 2 days will reduce swelling. Do not apply heat in any form for at least 24 hours. Heat increases swelling and pain. Sprains and strains are usually treated first with rest, ice, compression and elevation, RICE. Elastic compression bandage for the knee. Wrapping an arm splint. Place the patient's forearm against his/her chest. If this is painful, place a pillow or sheet between his arm and chest. Using gauze, a sheet, or a blanket, begin at the elbow and wrap the splint in a diagonal direction around patient's back, coming around his chest and wrapping the upper and lower arm all the way up to the hand. Secure the splint tightly with an ace bandage or safety pins. Apply ice to the area. Bleeding. Mild bleeding may stop by itself or by pressing the cut firmly with thumb and first finger. In case of severe bleeding, keep the victim lying down. Raise the bleeding part higher than the rest of the body. This reduces the flow of blood. If a bone fracture is suspected, do not move the person. 2. Place a thick pad of clean cloth on the wound, and press firmly with the hand. 3. Hold the pad firmly in place with a bandage. 4. Keep the victim warm with a blanket. Give him/her plenty of liquid, like milk, tea, coffee to drink if he or she is conscious and can swallow. 5. Call the doctor at once. Tourniquets are tight bands used to control bleeding by completely stopping the blood flow to a wound. They work only on arm and leg injuries. Bandaging of wounds. Wash your hands to remove germs. 2. Clean the skin around the wound with small pads of cotton wool soaked in an antiseptic. 3. Cover the wound with a clean cotton dressing. 4. Now put a thick pad of cotton wool. 5. Bandage firmly with sterile gauze, Disinfected thin cloth. Bleeding from the nose. When the walls of the blood vessels of the nose rupture, blood comes out. Keep the victim upright with head slightly tilted backwards. Ask him/her to breathe through his/her mouth. Press the bleeding side of the nose firmly. Place a wet cloth or ice on the nose and the forehead. Burns. First stop the burning process. Put out the flame or remove the victim from the source of the burn. Wash burnt area to cool it with plenty of cold water. Never use ice except on small superficial burns, because it causes body heat loss. Keep the affected area clean, let it dry and apply an antibiotic ointment. Cover the burn. Use a dry, clean cloth to prevent infection and reduce pain. Bandage loosely. Insect and animal bites. Insect bites and stings. If someone is stung by an insect, such as a bee or a wasp, remove the stinger by scraping it away from the skin with your fingernail or an iron key. Wash the area with soap and water, and cover it to keep it clean. Do this 2 to 3 times a day until the skin is healed. A bee will leave behind a stinger attached to a venom sac. Try to remove it as quickly as possible. Apply an ice pack wrapped in a cloth or a cold, wet washcloth for a few minutes to reduce pain and swelling. Get medical help right away if you notice any serious allergic reaction. Snake bites. Snake bites occur when a snake bites and inserts its fangs inside the skin. The victim needs immediate medical treatment if the snake is poisonous. Snake bites can be deadly if not treated quickly. Children are at higher risk of death or serious complications due to snake bites because of their smaller body size. The right antivenom can save a person's life. Getting to an emergency room as quickly as possible is very important. If properly treated, many snake bites will not have a serious effect. Tie a band or cloth about 2 inches above the wound. If there is swelling, tie the band about 2 inches from the swelling. The band should be at least an inch thick, and it should be tied within 20 minutes of the bite. As far as possible, do not let the victim move. Remember, the bitten limb should be moved as little as possible. Get the victim to a hospital as soon as possible. The most important point to remember in a snake bite is to immobilize the limb, tie it firmly above the bite, and keep it below the level of the heart before getting the victim to a hospital. Poisoning. In case of poisoning, try to induce vomiting and call a doctor at once. Do not give any food or drink to the victim. Animal bites. If an animal bites, follow the given treatments. For minor wounds, if the bite barely breaks the skin, there is no danger of rabies. Treat it as a minor wound. Wash the wound thoroughly with soap and water. Apply an antibiotic cream to prevent infection and cover the bite with a clean bandage. If the animal bite creates a deep puncture of the skin or the skin is badly torn and bleeding, apply pressure with a clean dry cloth to stop the bleeding and consult the doctor. Dehydration. Dehydration is a condition that occurs when someone loses more fluids than he or she takes in. About 2/3 of our bodies are made up of water. When someone gets dehydrated, it means the amount of water in his/her body has dropped below the level needed for normal body functioning. Losing larger amounts of water can sometimes make a person feel quite sick. The following first aid measures can be taken. Give a mixture of sugar, common salt and water to the victim at regular intervals. Give the victim oral dehydration solution, ORS. ORS is a recommended solution by WHO and UNICEF to prevent dehydration. It consists of common salt, glucose and water. Government healthcare agencies. The government has provided a network of healthcare agencies consisting of community health centers and primary health centers in local areas. The main purpose of these healthcare agencies is to create general awareness among the people about cleanliness and personal hygiene, maternity and childcare, timely vaccination and a scientific temperament.